It's been such a morale booster for the whole team. Ward 4 is a really physically and emotionally demanding place to work, and just to get that recognition of the great job that the staff do every single day, I'm really, really pleased for the whole team. It's absolutely fantastic.
Obviously delighted, but I guess it's really humbling to think that all these people, that you make a difference to them, and also really uplifting.
It was a pleasure to receive the award on behalf of all of the team and all of the organisation as a whole.
We're very proud to be recognised for the work that we've been doing. We're one of the first in Scotland to have done this role, and there's been a lot of interest in it since we started doing it.
It was a shock, but it's an astonishing journey. We really have been on an amazing journey.
It means a great deal to me, a great achievement at my age.
They're a warm team, they're people who care, and they want to work with people with dementia. They want to make that difference to everybody's experience in Ward 4.
If I didn't have a team of nurses who wanted to be the best nurse that they could be, then I don't think they would have been inspired. I just feel really proud that I've been able to help our team of nurses be that.
What I like most about being part of the team is that we do work really well as a team. We recognise when someone is having issues within the set teams that we're allocated on a daily basis. We help each other out, and it's nice to stand back and watch the team actually gel together.
We do have a fantastic team, and we have a very good working relationship. Between us, we probably have over 90 years of experience in physiotherapy, and that's one thing that we bring to this role. It's really important that you have a lot of experience and patient mileage behind you in order to deliver a really effective and safe service to the patients.
We've all enjoyed each other's company. We all really get along. So you've got a real team spirit.
Even if you could take their mind off their problems for a minute and make them smile, that's basically what you want to do. Make them smile and make them take their mind off their problems.
You spend so much time with relatives, supporting them and just giving them information and just being a shoulder to cry on sometimes as well. So that makes it such a rewarding team to be part of.
And we take the positives and we also take the negatives, and we try and change the negatives to positives and how we can help each other out and use our experiences to draw upon that as well.
It's always lovely when people come and say to me that they've done well and they're going to be discharged and they're healthy and they're happy, and it's just nice to share in that, the joy of that particular moment.
Well, it's just my nature to help people, as I say, less fortunate than myself, and I enjoy the work.
We all like singing, and the whole point was going to be going out to different wards, and we're going to sing to the different patient groups. But when you get it right on the night, there is a group euphoria that comes with that. But the other thing is the feedback that you get from your audience, and that we were humbled by what people did with us today. And actually when we go out to wards as well, we have a lot of patients that will sing along and different things, and that's really great feedback.
I am strong when I am on your shoulders.
I think it was really good because we got to work all together as a class and build up different skills that maybe we've not done before.
It's helped me build your friends and your friendships.
The dancing was my favourite because it makes me feel really good.
We got to do a wee bit of freestyle in between each bit.
It's very important to get exercise when you're younger, so then you're fit and your body's healthy and you're circulating all that blood around your body, and Max and Middle really helps with that.
We've been working with partners to do trust things. When we were doing the breathing, I felt really relaxed and made my body feel a bit better.
It's important to clear your mind so you can just focus on the thing that you're doing and breathing properly.
If you're really stressed or something's happened, then you could try that and it maybe calm you down and you can maybe work it out.
It's helped me work my team working skills and working together.
I like to do dancing to keep fit.
I like to do gymnastics at home.
I like to go walk my dogs.
I like to ride horses.
I like to play football.
It's fun because they give you ideas on what games to play outside.
I think it helps as well because then you go home and you want to learn it and you get really active and gets you really pumped up and you want to do it at home more.
Across the world, there is a growing public health crisis. Falling levels of physical activity have contributed to high levels of obesity in many young children. According to experts, kids should have an hour of exercise every day. However, less than half of 7-year-olds actually do. And amongst children from deprived backgrounds, the numbers are even worse. But it doesn't have to be this way.
The Daily Mile is 15 golden minutes of childhood when the children go out into the fresh air and do running, jogging or walking at their own pace every day.
I've noticed that they really enjoy running the Daily Mile. I do it with them.
Actually, children are talking about health benefit. They're talking about how mile run is helping them. They think it's a part of their daily learning.
Daily Mile is completely inclusive. It's every child, every day, whatever their needs, and all children succeed no matter their age, their ability or their circumstances.
It's really fun and it exercises your muscles and your brain and your heart. When we started, it was quite hard. I've been getting better and faster as I do it.
We are putting these good habits now so that when we grow up, we are healthy grown-ups.
It looks like they're a bit fidgety or if they're beginning to be off task. It's quite a good time to take the children out.
When you get a little exercise, your brain starts working properly.
Knowing that they've got that sort of 15 minutes to recharge their batteries and clear their heads really does provide more focused learning after the Daily Mile.
It's been so positive. It's unlike any other project or program we've ever tried to implement. I've never seen so much enthusiasm and passion from teachers about anything as I have about the Daily Mile.
If teachers haven't yet adopted the Daily Mile, then I would definitely suggest it. It is something that's not a huge time investment, but actually the gains are so much more.
The Daily Mile is in 18 countries across the globe and growing. Children really love it, and that's why it works.
If you're young, you're probably not planning on popping your clogs anytime soon, but it's never too early to join the organ donor register. We need everybody.
If your child is 2 to 5 years old and not in school yet, there's now a simple nasal vaccine that will help protect them from flu. Your little ones should renew their flu vaccine every year, so make sure they're covered. Contact your GP practice and make an appointment today.
I think it's a great city, you know, and this part, you know, I was brought up in Govan, I mean, it's there's the fire station, my house was there. Of all the things I've done in my life, one of the most important has been to support detect cancer early. Today I'm getting the chance to meet a man whose life was saved by getting himself checked out. Welcome to Govan. Good morning. How you doing?
Morning, Sir Alex. Pleased to meet you.
This is Tom Hart. Tom was diagnosed with lung cancer 5 years ago and he's still going strong today. A Pars fan, eh?
That's me, aye.
Oh, your wife?
I'm alive.
But I went in from 64 to 67 and that was my best period, believe me, it was my best period as a player. But now tell me, you've had a really, you know, testing time and you're looking great and you're on with your life.
Aye, yeah. I mean, life's fine. I mean, I'm just doing the things I always did. I was diagnosed 5 years ago. I had a persistent cough. My wife was giving me a wee bit of stick about going and getting myself checked out, and then it was my GP that told me that there was a tumour in the centre of my right lung. And that took the wind out my sails.
Oh, you did.
Through to the beats and got treated. No side effects at all, and the treatment had worked. If I hadn't gone when I did, I might not have been able to be sitting here having this conversation with you, you know.
And the support you get for the medics?
Can't praise them high enough. I think you've got to put your trust in the professionals. These people know what they're doing.
Absolutely. But this is the issue about lung cancer. My mother and father died with it. Now you go back then, they didn't have the access to the treatments you've got. The methods of treatment are far, far superior to they were 20 years ago. And you've been a benefit of that.
I think the message is simple. If you have a persistent cough, it may be nothing.
Yeah, but
go and get it checked.
Right. Exactly.
Go for half an hour out of your day. It could mean the rest of your life.
Yeah. And what you did that, and that's why you're sitting here. When anyone's seen this, and they'll see your attitude, it won't help them. Trust me.
I hope so.
Yeah, well, absolutely. Well done. Well, Tom he had the right attitude to it. I think that's the example we need. Detect any signs, a cough, a little cough, don't take any chances. So half an hour of your time, go to your GP, and it's amazing what can be done from then on.
Just to prove to my pals tomorrow that
I
did speak to you.
Lots of people have joined the organ donor register, but there's still people dying, waiting on a transplant. This is why we need everybody.
Don't waste your time watching me. It only takes 2 minutes to join the organ donor register. So crack on. We need everybody.
Even if you have a few wrinkles, you can still be an organ donor. We need you to join the register now. We need everybody.
An organ donor saved my life. So if you support organ donation, don't put it off. Come on, join the register. We need everybody.
Spare tyre one? It doesn't matter what shape of body you've got. You can become an organ donor. So go on, join the register now. We need everybody.
Does referring to your vagina as a flower make you feel a little bit sick? Is watching this video enough to make you want to hide inside your jumper? Are you playing it very small in the corner of your screen or covering your phone with your hand on the bus? Does the thought of getting your flower out for a smear test make you shiver? How does the thought of developing cervical cancer feel? 6 women are diagnosed with cervical cancer every week in Scotland. So it's time to stop fannying about and get tested. Let's nip cervical cancer in the bud.
Everybody could save a life.
Wrinkly ones.
Spare tyre ones.
Pretty ones.
Lean ones.
Noisy ones!
We need everybody, because somebody dies every day in the UK waiting for an organ transplant. Join the organ donor register and you can save a life. Take it from me.
My name is Gabriel Orniscu. I'm a consultant transplant surgeon at the Royal Infirmary in Edinburgh. My role is in performing the liver, kidney and pancreas transplantation. I'm also involved in the living donor program, and my responsibility is in removing the kidneys that people donate to be transplanted in someone else. So I get involved quite early in seeing the patients in the assessment clinic when they first come forward as a potential donor, and therefore follow them up throughout the entire assessment process, and ultimately performing the operation and getting the kidney ready for transplant in someone else. And therefore I have a very close contact with the potential donors throughout the entire workup. When patients come forward as potential living donor in the clinic for the first time ever, this is a very important conversation. Any operation has complications and has risks, and to me, working in a living donor service, the paramount thing is safety. And donors need to understand that any operation, no matter how big or small, has risks. The difference here is that there's an operation that they do not need, and therefore they need to understand the immediate risks related to surgery in general and the specific risks associated with living with one kidney. Of course, we're learning that long term there may be implications of someone having donated a kidney, although some of that may be dependent on the choice of life they take after the donation. Some of them are intrinsic to the donation process itself, but the risk, as you know at the moment, still remain low. Transplantation is by definition a very rewarding job, simply because you see how the quality of life of a recipient is restored to normal, and they really go back to running an entire normal lifestyle, having children, running marathons, or purely enjoying life. But over and above this, living donation is probably the one that is most rewarding, because there you have people who come forward as potential donor, not for their benefit, but for the benefit of their friends, relatives, and nowadays even complete strangers. Living donation is an important part of our transplant activity, and it is fair to say that without it, a significant number of patients would not be alive today. But over the last 10 years, we have made significant changes into the living donation process to enable everyone to be a donor, irrespective of their age, blood group, relationship with the potential recipient, or even indeed if they don't have a recipient. What we're trying to do here is to enable as many patients to receive a living donor transplant, and this is the way we want to see the waiting lists coming down. Transplantation is full of special moments because you see the benefit that a donated organ brings to someone's life, not just in terms of prolonging their life, but also improving their quality of life. I guess the moments that would stand out for me are the fact that a living donor, a normal healthy person, comes forward to donate a kidney to a complete stranger. And this is humbling for me because this is where it's all about. That's the human nature of helping each other, and I'm really astonished by their gifts.